If you had the chance to change an aspect of your look, would you take it? I mean, a pointier nose, a flatter tummy, or maybe a bigger bum bum. Would you take that? That's basically the attraction to cosmetic surgery. And here, or straight to the point, we'll be looking at all aspects of cosmetic surgery, but the most important question, is it really worth it?
Admit it. At one point in your life, you've considered changing that imperfection. Just making yourself look better. Maybe not too much, but at least enhancing your look. What if you were told that with medical miracles, with technology, you could actually do all of that with very little side effects? Would you take that? Would you do that? That's why we are discussing here on Straight to the Point cosmetic surgery or cosmetic enhancement, the attraction to it, all the aspects of it, morally, socially, economically, spiritually, yes, and then medically. Should you do it? Can you do it? Would you do it? That's what we're talking about right here on Straight to the Point. But do me a favor, go to the subscribe button and click on it. And don't forget to put on the post notification, because this conversation, I tell you, you're definitely going to want to watch and share, because I have the right person here to talk about it, a plastic surgeon who could talk about this better than the maestro themselves. Welcome, Dr. Rex Dafiwari.
Thank you.
Okay, so before we go forward, I want to tell you about something I did before this conversation. I spoke to my circle, 23 people, 18 women, 6 men, yes. And I asked them, if you had the opportunity to change anything about your look and it was medically safe, no side effects, nothing, what would your answer be? Now, guess what the results were? All 18 women said yes.
That's not
yes, I will change something. I will do this and do that. 4 out of the 6 men said yes. Now, do you know why the 2 men said no? Fear of needles. So they said, if you can guarantee that there'll be no needles, why not? I could do this. So what are your thoughts on that just very small microcosm of people that I did a research on, which pretty much is a reflection of a whole larger audience? But what do you think about that?
I think what you found is pretty representative of a large number of people, probably the majority of people in society today, living today, wouldn't mind if they could change 1 or 2 things about themselves. Interesting enough, over 15 years ago, I did a small study. This then was in Kano. It's a conservative town, like you know, and I asked certain questions, and it was the same thing. Now, this was in a university setting. I asked medical students if they thought about this and thought about, in spite of all the religious things going on there. And almost everybody wanted to have something changed about them. The only problem, of course, was either religious beliefs or if they could do it without having to do surgery.
Oh.
So if there was a miracle drug, fine. It was okay. So it was when surgery was put in there, then the numbers went down because they were scared of surgery and then probably the effects of surgery.
But they really didn't mind changing 1 or 2 things about
Yes,
that.
the majority of people will want to look better.
Why would you say there's now a boom of people who are willing to go under the knife to get things changed? Because I understand that study 15 years ago. I mean, a lot of people were worried about our maybe medical capacity at that time. But what is the attraction now? What has changed?
I think it's media.
Oh.
Yes, it is. So when you see someone who has done it and they came out fine, you go like, why not? If she could or he could do it, then I can also do it. And then, of course, surgery is becoming safer with time. Technology is better. So the success rate is going up. So walk in, walk out. I mean, we wouldn't have procedures where you do it lunchtime and you go back to the office and no one knows you did anything. Just know that you kind of look different. You say, oh yeah, I went to the gym or something. So
I like that. Everybody is attributing that little extra nip talk to a gym, and oh goodness gracious. But then let's go straight to it. What are the things you need to consider before, or the things you need to factor before you even consider having a cosmetic surgery?
Well, to start with, all surgery is surgery. So it's serious business. So you should be sure it's something you want to do. Yes, surgery is much safer now,
Okay.
and we have procedures that are not so invasive like they used to be before, but it's still surgery. So if anything can go wrong in any surgery,
Anything can go
anything
wrong.
can go wrong in cosmetic surgery. So it's not because it's cosmetic surgery, it's because it's surgery. For instance, now people wouldn't, uh, most people wouldn't bat an eyelid about someone going for a cesarean section because, oh, you're going to give birth. But it is surgery and it can have complications along the way. Or even taking your tooth out. It is surgery and people have died taking out their tooth. So
So,
so that's just what it is. Surgery is surgery is surgery. So you have to take all the precautions that you need to take before you go into such a thing.
and would that also include finding the right surgeon? Because while surgery is surgery, the surgeon is the artist.
So it gets a little bit tricky when you're talking about finding the right surgeon because people have tried to do things like go online and find someone and all that, look at befores and afters. But we live in an age of technology. There's AI, so I can brush up my pictures. I can get pictures from somewhere. So while it is good to go to a website and see before and afters, eventually most people will get to meet their surgeon on one-on-one. Maybe your friend went there, someone you know. So a lot is about who has gone there and survived, right? And came out with a good result. So,
Yes, because
so
I'm glad you used that because it's one thing to survive. It's another thing to come up with a good result, which we
yeah.
will talk about a little later. But what are some of those procedures that you would consider cosmetic enhancement? I mean, in your
For
line
us,
of work.
anything that you do that makes you look better is cosmetic. So this is different from when you do a surgery that is functionally based.
Okay.
Okay, so for instance, if you were born with a deformity
Okay.
and you couldn't breathe properly with your nose or eat properly like in a cleft lip. Now children are born that way, and you fix it, you wouldn't consider that as cosmetic.
Yeah.
However, the lines begin to get blurry if what you do as a person is going to be affected by how you look. Now that comes again to back to how society sees you. For instance, now, if you're doing a health show, you don't want to do a health show with a bulging tummy, even though you know all the secrets of being healthy and you're physically healthy, but it probably wouldn't sell. So
Yes.
at that point in time, you ask someone who is in that situation will say, look, this big tummy is not helping my market
It
right
can't
now.
sell the
It's
market. You
not, yeah,
can't.
yeah. So he or she is going to ask for something to be done, but it's not because they cannot live without it. So the line gets blurry there. Is it now a functional thing or purely a cosmetic thing now? So those lines get blurry as society advances and the definitions of right and wrong tend to
Yeah, I
shift.
know. I'm going to go into some of these very specific surgeries. A lot of things are coming into my head. Mommy makeover. Like, yes, we will talk about the moral and social, but let now that you have talked about it, let's talk about mommy makeover. I mean, bringing life is a huge deal, and you already know the toll that it takes on our bodies. I too had two C-sections and multiple other surgeries, health issues, and I do have a lot of concerns. Many you can't see, but of course, when the clothes come off, there's some sort of, discomfort with being seen or even looking at yourself. So when you think of you have already birthed a child or you've brought life, but now you want to turn back the hand of time and look like that. Is the line still blurry? Can't you see that's functional as well? Maybe
Okay.
I'm looking for an excuse.
So the thing now that is that now some people are beginning to argue that a mommy makeover should be paid for by insurance. Now the argument is coming up. It doesn't mean the insurance companies are going to say yes to that, but people are beginning to see that someone has birthed children over the years, and you have it's a kind of contribution to society, if you want to put it like that. I mean, the society has to continue. So she has put her life on the line, and her body has gone through this wear and
Yes.
tear. It's taken its toll, and all she's asking, she's not saying make me like a superstar. She's just saying just
Take me back to what I
take me
used to
back
look
to
like
what I
before
used to look
all
like,
of
or at
this.
least something that I can look at and say, okay, fine. So I'm one of those who I wouldn't typically just classify it as pure cosmetic for the sake of just looking good, because sometimes really beyond just the looks, sometimes the birth actually does some damage. So what happens in such situations is that while we are repairing the damage that happened, why not make it look good at the same time? I mean, it's just like if your car had an accident, a dent, you could go to the panel beater and then they beat it out.
Yes.
So the shape is back there, but the paint is gone and all that. So why don't you just put some nice thing about it and spray it and make it look nice? So that's
Dog
what the
chop
cosmetic
knuckle,
surgery
chop
does.
knuckle. And like, it needed to be
Yeah.
said. I mean, of course, people have their various reservations about cosmetic surgery, which we will come into a little bit. But let's talk about the moral or the religious aspect of it. You know, it is believed that almost in every religion, it's believed that God did a perfect job in every human being. And beauty standards are different worldwide. I mean, there are some places like having humongous features is beauty. And in some places, like maybe in Asia, that's grotesque. So, but morally, as a doctor and as a person, what is your stance on cosmetic surgery? Do you think that we're tipping the balance here? Are we trying to play God, or are we doing something that God would get angry with us? I mean,
I don't think we can play God. We can never play God. And as per morals, it will always keep on shifting. Personally, I don't believe in 2024 that God is creating any human beings. God did that with Adam and Eve, and he retired from that. That's a personal thing, and I don't see anything that will stand a good argument against that. Because if you push it further, when you say that God created perfect people, what happened to all those people who were born with congenital anomalies that we all want to fix? Does that mean that we're fighting against God? I have a set of beliefs which just says that, look, God made Adam and Eve. They were perfect, but things went wrong. I mean, if you're a Bible student, you know things went wrong. And there are certain negative forces at work that nothing is perfect anymore. So if you can do something about it, fine. If you can't do anything about it, then fine, live with it. But I wouldn't say that God creates people perfect.
so you shouldn't have you are not committing any moral turpitude, sort of, by just deciding, you know what, I want to go under the knife and make myself different.
Yes and no.
Ooh, so it gets blurrier, really.
So the thing is this, you have to look at the intent.
Okay.
So now that comes from the person.
Okay.
Right. Well, on the person's side, the why is very important. The why is always important. So when you're having a consultation with a client who comes in, it's good to know the why of the person, because if the why of the person is not sorted out, the person will never be satisfied. If the
Yes.
person is doing this because she wants to get her husband to look at her better and all that, this doesn't work. Let me just take a short detour. I once had a client who came in, she's had many children. And of course, that came with the tummy laxity and all of that. And unfortunately, she has a husband who would make comments about it. And she wanted to have something done. He didn't want her to have something done because he was scared. Oh, she might die. What will I do without you? But that didn't stop him from having side chicks. So how does she deal with that? You don't think my body is good. You're having side chicks. You don't want me to fix my body. She's trapped. Right. So Hawaii, in this case, you say, don't do this because of your husband, but if you feel uncomfortable about it for yourself, then go ahead and fix your body if you can. Find the right place, right time, and all that. Get it done.
I think it's pretty complicated when we begin to talk about the whys, because a person can literally tell you, I'm trying to save my marriage here. Because, I mean, come on, we don't want broken homes. I mean, she's got many children. We don't want broken marriages. So, and I have to tell you, when you get married, everybody tells you have to look good. You have to look this perky and all of that for your man, so his eye will not wander. So when they are obvious defects, obvious flaws. I mean, come on. Every woman wants to be the center of attention. What would you, I'm sure you doctors, you don't try to, convince anybody to do anything. But if she were your spouse, what would you say to her?
I think if your spouse, now it gets complicated when you're bringing in another person. So that's why I see for a lot of times, most people who are having cosmetic procedures walk in, walk out are single, right? Single women,
Yes,
and
yes,
all that,
yes,
because
yes.
they make the decisions.
By
No one,
themselves, yeah.
yeah, kind of thing. But it's good to have your close people, your family, or at least someone in the game with you to support you through the process, because it is a process. It's not going to shop. It's not a shopping experience in the mall. It is surgery, right? So it's good to have some support, especially from your spouse, right? Or your significant other, like like they say. Right, because if you have that, then you have that support along
Yeah.
the way. If you don't, you go do something, even if it turns out right, the person might feel slighted and all that kind of thing. So it might not help if you're doing that for the sake of the relationship. But I always tell my clients that nothing, nothing will make a man to stay with you if he doesn't want to stay with you, no matter how beautiful you look. Look, let me tell you, I've had very good looking clients, very good women coming. You look at their bodies, like there's nothing wrong with your body, madam. You're good. And they think that just that extra nip
Nip
here,
talk.
a little thing here is going to help. It doesn't help.
Do you think that people should go through psych eval before a psychological evaluation before they actually think about having surgery? Because sometimes it might just be a confidence issue that maybe talking to a therapist or even talking to, I don't know, maybe a religious counselor, something could fix. Do you think before you even have that consultation, you should send them to go get their
So
minds
50,
checked?
I'll say probably like 50% of my consultation is that.
It's psych eval,
Yes.
right?
So sometimes I come home and I tell my wife like I think my office is more like a place where women come to unwind, because they come in and doctor, I want to do this. It's a 3-statement request, and then the next 1 hour we are talking about their whole family history and everything, because I just allow them to talk. People just want to vent. They have stuff, and then we go through it, and then we try to match the social problems that they're having back with the procedure that they want to have. And the truth is that a number of them eventually really see that they really don't need the procedure. I'm a little bit different. I'm not in a hurry to go put people under the knife.
Yeah.
Right. So a lot of them find out that, okay, it's not about this. Then those who now remain and say they really want to have this, then it's a smoother sail. Because if you do a procedure for someone, if it doesn't solve the why, she's going to come back for more, thinking that she needs more.
That's where
to
the
have.
addiction happens.
Yes, that's where it happens. So you want to be careful too with such patients, because they can really be a bother on you. No matter what you do, she's not going to be happy. Everybody around her is saying you look great. She's saying no, there's a little bit of fat here, there's a little bit of this here. And I've seen one or two like that.
Is
It
that
happens.
is that the norm? Is there a greater propensity to be addicted to cosmetic surgery? Because I have heard that sometimes the search for perfection can just delude people. Like your nose looks good, but you think it's a little crooked. Have you seen that? I mean,
So everybody has that right now from your little research. So imagine if you had the success of fixing one thing. It's just like when you renovate your house. You say, oh, it's only the kitchen I want to do. You do the kitchen looks nice. Like, why don't I do the bedroom? Now why don't I do the sitting room? Why don't I do this? So it can go on like that. But that's why you need to have good support systems around you to say, look, babe, it's enough. You look good. Just stop there. That one, that was the main problem, is okay. Just stop, right? Unfortunately, now this thing is sometimes it's tied to finance.
yes.
So your attending doctor might just want to throw in more procedures because it's profit,
Yeah.
right? So you have to be careful too if your doctor is always assenting to everything that you ask for. A good doctor should look you in the face and say, no, sit down, and that's enough.
It's enough.
That's okay.
It's
right?
enough.
Yeah,
It's
but
enough.
then you can't legislate for people what they should do in their practice.
True, because they'll leave you and go to a different person who would say yes.
So that has happened to me before, and I don't mind, right? So for instance, now I've had someone who is not just a client, I've known her for years. She wanted to do something, and I said, you're not fit. No. You're not healthy for this, and all that. And she harangued me, and then 1 year later, she comes back, I think I'm better now. And no, you're not. And I'm not talking to you anymore. It's okay. Don't talk to me. So you have to sometimes be firm with people for their safety, because,
Yeah.
like I said, it's surgery.
It's surgery.
Yeah. So you have to be cleared that you're healthy enough to go through the procedure. There are certain guidelines that we need to follow.
I mean, this is a very, oh, God help me, this is a very personal conversation for me, because in the past 20 years, I've had 6 surgeries. I've had 2 C-sections, 1 myomectomy, 1 hysterectomy, and just about few months ago, I had a explorative laparoscopy
Laparoscopy.
that was as a result of blocked intestine,
Okay.
intestinal blockage. You already know what my body looks like with all of those scars. And I am not going to lie to you, when I take off my clothes, I used to have this incredible body. Oh, I mean, and everyone would say to me, you don't look that bad, but I still see what it looked like pre-pregnancy. And sometimes I wonder, I've had 6 surgeries. If I ever wanted to just, fix all of this, would a doctor just turn me back and say, will you go home? Are you not happy that? But doc, I'll be very honest with you.
Yeah.
If there is a surgery, I'm very open to having 2 surgeries. Actually, one would be to correct my sidekiss. But that cosmetic surgery is a facelift. I would be open. I'm serious. I would be open.
And then I will ask you why. You look good as it is.
No, not now, because I have a strong feeling that what if my face becomes older than how I feel? I mean, what if I hit 40? I mean, I hit 50, 55.
Well, the good thing
And
is
then the face just droops, but the body's looking peng. How do I reconcile both?
well, you know what they say, black don't crack.
Ooh.
Right. So what we lose in terms of scar formation, we gain in terms of having a firmer skin than the Caucasians. Yeah.
Oh.
Yeah.
So I have firmer skin right now.
Yeah. Yeah, the average Caucasian will sag with time. The average black person will not sag as fast. Yeah.
I think this is quite reassuring, actually.
Yes.
Yeah, so there is some gain to all that pain
Yeah.
over the years.
Yeah.
Oh my God, this conversation is not even close to over, because I have questions that people ask me to ask you. When I told, the humans that I ask
Yeah.
questions, I'm going to be sitting with a plastic, so Gloria, you must ask. And I'm sure you have quite a number of questions as well. So go on the comment section and leave Dr. Rex your questions. And I'm sure we'll leave information, because I'm sure some of you might want to have private consultations with him as well. So please go ahead, talk to us in the comment section, but most importantly, click on the subscribe button so that you will know what we're talking about next here on Straight to the Point. And yeah, the notification as well, don't miss that part. Stay with us. What would an average tummy tuck cost? What would an average BBL cost?
It's difficult to say. The dollar is on the it's on the rise all the
What has
time.
dollar got to do with
Dollar
BBL?
has everything to do with it, because all the equipment we use is bought outside the country. One of the most common complications that all the fat may not take, and if the fat doesn't take, it now dies. And what's the reason for that? Sometimes, right, a lot of times it's the volume. It's called being booty greedy. When you're lying down, it may look perfect. By the time you stand up, it may not be as good, so you may need to have touch-ups, right? So those are some things that can happen. So inequalities can happen.